everybody. Welcome to the Frank and Lizzie show. It has been a bit. We are so excited to talk about today. We have such a great guest, and we're talking about such a unique subject that I feel wound care clinicians may not always think of. So I'm going to let Frank tell you more about it.
Well, Lizzie, I agree with you. I am excited because we're going to hear from a patient advocate, but actually, she's a patient herself, and she's going to educate us on a condition that we may not know how to treat. But she's going to share about the world's first and only safe retaining wearable wound dressing. And that's a mouthful, but I'm going to tell you that I wish I would have known where this product existed when I was treating these patients. So without hesitation, I do want to introduce Suzanne Maloney, and we're going to let her tell us about the condition and the product. So thank you, Suzanne.
Thank you for having me. It's a pleasure to be here, and I'm really looking forward to sharing my story. So I'll just jump straight in, will I?
Yeah.
Okay. So I'm going to share a presentation, and hopefully you can see it.
Yep.
Okay, so my story starts when I was about 12 or 13 years old, and I started to develop these lumps and bumps in around my bikini area and around my groin. And I was really, I suppose, unsure of what was happening. And, you know, you're going through puberty and your body's changing already, and you're awkward and embarrassed about that. And I hid these symptoms for years because I was so embarrassed about it. I continued to self-manage these at home until they got really bad when I was about 17, and I was brought to my GP, which is like a family doctor. And I was treated with antibiotics for a skin infection and abscesses. And they would resolve, but they would come back. And they recurred so much that I was essentially treated every couple of months with antibiotics until I was about 20 and I needed surgery. And over the years then, I had a huge different variety of treatments offered to me. A lot were antibiotic based, short and long-term antibiotics, intralesional steroids straight into these lumps that would kind of reduce the symptoms a bit. I've had IV antibiotics, was at the hospital, multiple times every couple of years. I did hormone therapies. I've been on biologics, IV ertapenem, and I've unfortunately had multiple surgeries, I think around 13. And you can see here that they're all in very kind of awkward, difficult areas of the body. And it wasn't until I was 23 that I was actually diagnosed with hidradenitis suppurtiva. So 10 years from the onset of symptoms, which unfortunately is very normal for patients. My story isn't a lot different from the majority of patients out there today. So what is hidradenitis suppurtiva, or HS? Well, it's a chronic inflammatory, recurrent and debilitating skin disease of the hair follicle that usually causes painful inflammatory nodules, abscesses, comedones, scarring, and tunneling sinus tracts. And it most commonly affects the armpits, the groin, the genitofemoral folds, gluteal, perineal, and inframammary areas. But it does occur on almost every part of the body. So you can get it on peristomal areas and around the areola, submammary fold, the scalp, the head and neck, the thighs. And behind the ears. I actually have quite a lot of HS behind my ears, believe it or not. So what's it like to live with HS? Well, it is a nightmare, if I'm being completely honest. It is so debilitating and unpredictable that it's difficult to live a normal life. So my HS comes in flares, and this is the diary of a typical flare for me. On the first day of a flare, I'll feel sick. I just, have a bit of a temperature, muscle fatigue, brain fog. I'm just very tired. I'll find a lump in my skin that's hot and tender, and this will start to grow or even develop over the coming days. And you can see that this is actually on a surgical site. And that's the recurrent nature of this disease. It's relentless. You can have multiple surgeries and it will still come back in the same area. On the following days, the area becomes more painful and inflamed, and this affects your mobility, your ability to even hold your arm down, to lift your arm or to move. And the skin gets very stretched and tight. And eventually, after about a week, it will rupture for me. And an opening appears and it starts to drain. And the volume of exudate is astonishing that comes out of this. And it's a mix of blood, pus, serous fluid. You never really know what you're going to get. And underneath my skin there are sinus tracts, and they'll continuously fill up again and drain again. So this part of my flares can last for a few days, or it can last for weeks and sometimes even months. But once it starts to calm down a bit, the skin is left very pitted, it's disfigured, and it's incredibly painful still. There's lots of openings in the skin that are trying to heal. So you get this sticky granulation tissue. It's very painful. And unfortunately, these tunnels underneath the skin are still producing exudate. So there is still, a lot of drainage coming out of this, albeit not as much as the initial flare. And there's a really big wound care requirement for patients. And I'll just show you a video of what it's like on a day-to-day basis. Sorry. So this is my groin, and I know I should be wearing a glove, I apologize. But this skin looks quite, normal to me anyway. But when I just apply the most gentlest of pressure, you can see a lot of exudate just seeps out from multiple openings in the skin. So if I'm going about my day and I'm walking or standing up, or maybe I'm in the gym, the kind of movement and the motion of my leg is pushing that exudate out. So this is really difficult to manage from just a normal day-to-day experience.
Wow. And that's your hand and that's you?
Yes, yeah, that's me. That is me. Making home videos to try and just, I suppose, get the message out, because what I think is really important for clinicians to know is that when you see the patient, you see them for, 10, 15, 30 minutes, and you see them at a point in time and you're not getting the full picture. And that's why I think it's so important to talk about the entire duration and experience of a flare. Because sometimes it can be really bad when I'm at the doctor, and sometimes I'm at the doctor or with the nurse, and they're like, it's not that bad at all. But it would have been very bad, a few weeks previously before I was able to get my appointment. So I just like to highlight what it's actually like to live with this. And despite all of the surgeries and all of the different treatments and the side effects from the different medications, my biggest challenge on a day-to-day basis has been managing the drainage and the exudate wound care. And, you want to live a normal life. The majority of HS patients are young patients, in their teenage years or early 20s, starting out in life, starting high school, their first job, their first relationship. We want to be able to live our lives. And unfortunately, having to manage this exudate really puts you on the back foot from the moment you wake up in the morning. I have honestly tried every type of dressing under the sun, and I found it just incredibly challenging to keep anything in place. The adherent dressings or the adhesive dressings that I would use would kind of pinch my skin, and they would cause a lot of damage to my skin when I removed them, because you're doing a lot of dressing changes every day. And then the more skin-friendly adhesives would peel away. As soon as you start to move, you put it on in this position, and then you put your arm down, and already the corner has come away from your skin. And eventually those would fall off. I found the non-adhesive options like tape and netting and things like that, they were obviously more skin friendly, but really difficult to still retain a dressing in the armpit or in the groin because you're moving. And, you know, they would restrict your movement then. And all of the dressings that I tried really just would leak. Sometimes they'd move and sometimes they'd even fall out. And I just found this a kind of crazy that I didn't have any options for me to go about my day and live my life. And I started talking to other patients in the HS community. And eventually I started surveying them. And this is actually, I have a publication on this that I'm very happy to share with you, just to show the impact of managing HS wounds on a day-to-day basis to the patient. The survey showed that 2/3 of patients need dressings for over 6 months in a year. They're doing on average 3 dressing changes per day and spending about 8 hours every month doing dressing changes. And if you put that into context, that's a full working day out of your month just spent on doing dressings. It also showed that the majority of patients report dressing changes as a painful experience. They also reported that having to do wound care on a daily basis has a negative impact on their quality of life. 44% of the patients surveyed are using improvised dressings like sanitary towels, kitchen paper, adult nappies. And
what are nappies?
Diapers, sorry.
Okay. American based. Okay.
Yeah, diapers.
Gotcha.
Yeah, so adult diapers or incontinence.
Oh, gotcha. Okay.
And again, these are like the majority of these patients are young people. You don't want to be doing this. You know, that just brings a whole new level of anxiety. Where you're like, can people notice my diaper? Or is this sanitary napkin that I have stuck into my clothes going to fall out? And even worse than a dressing falling out, you know, it's psychologically very difficult to manage that, the voice in the back of your head that is kind of thinking, you know, have I left a stain on that couch when I stand up? Or, you know, have I leaked through my clothes? Is anyone going to see? It's honestly, the psychological aspect of this disease is as bad, if not worse, than the physical symptoms. The majority of patients, again, have experienced dressings leaking, moving, falling off, and 85% experience adhesive skin sensitivity. So I suppose my experience was one thing, but then I saw this is a big problem, and the majority of patients are experiencing the same problems and challenges as I am. So I wanted to find out what's important to HS patients, and I suppose the answer was pretty straightforward. They want products that will securely retain the dressing in place so that they're not going to fall off or they're not going to leak. They want something that's kind to their skin so it doesn't damage the wound or the surrounding skin and cause further pain, because HS is one of the most painful dermatological diseases to live with. It's sometimes really unbearable. And they want something that's comfortable and quick and easy to use so that they can just go about their day and live their lives as best they can. So that's it. That's the patient experience of living with hidradenitis suppurativa from a wound care perspective. And I suppose I'm just really grateful for the opportunity you've given me here to talk about that, to share my story and some more information on HS.
No, it's great information. I mean, certainly there's so much we can learn from patients in any disease state, but I feel like particularly with HS, there's, you know, the other thing that we learned at conference this year, we had a segment on HS at the APWCA's Wound Week, and we learned from patients and providers just how many clinicians the patient has to go to in order to get a diagnosis or to get appropriate treatment, because sometimes the wound care provider is ordering this, and you know, dermatology is ordering this, and then general surgery is doing this, and their GP is doing another thing. So it's a lot of
Yeah,
mismanagement and a lot of coordination of care and a lot of pointing fingers at who's doing what. Like,
completely agree. Yeah.
yeah, wound care providers might say, well, you need to be on biologics, but dermatology is going to prescribe that. And then if dermatology doesn't, what is the patient left to do? So, um,
Yeah.
but one of
And
the
I just, oh, sorry.
I was just going to ask you, as a wound care provider, what words of wisdom would you have for us when we are prescribing? Because unfortunately, like here in the US, we order a 30-day supply. And if we mess up, you have a 30-day supply at your house that you have to kind of deal with for that period of time. Sometimes
Yeah.
you can get them to swap, but oftentimes once they're in the home, there's no going back. So if you could offer words to wisdom for our wound care clinicians,
Yeah.
when prescribing dressings, what would you say?
I'd be happy to. I think there's a couple of considerations that are important for patients and from a practical perspective. Um, Ease of use is really important because this is an incurable disease that patients will be living with for, or managing the exudates for weeks and months on end. So something that's quick and easy to apply, easy to adjust if they need to, and something that's easy to remove as well. Um, Ideally, something that's not going to cause further pain to the patient. As I said earlier, it's an incredibly painful disease to live with. Your skin is already inflamed, it's sore, it's swollen. So, either low adherent or non-adherent dressings would be great. Um, just something that, yeah, isn't going to contribute to the existing pain of the patient. So securing things with bandages or garments if possible. Something obviously really highly absorbent because HS can just go. It can burst and it can catch you off guard. It's caught me off guard so many times throughout my life. And you have to kind of go and hide away in a bathroom in some shopping mall or in a restaurant and try and clean yourself up. And it's when it goes, it can be quite explosive. So something super absorbent or very highly absorbent dressing pads. Ideally, something that's quick to use as well, so that patients can, if they're out in work or on a date, they can just nip into the bathroom, change the dressing nice and quickly, and go back about their day. Something that's comfortable as well, and ideally, something that can improve patients, body image and confidence, because your body image is already severely impacted by living with such a grotesque disease because it is disfiguring. And, for me, I'm a young woman, and, to have all of these scars and exudate draining from my skin really does impact my body image and how I feel about myself. So something that is like empowering and enables patients to take control of the disease and gives patients a bit of agency over their disease would be great. Quality of life is severely impacted. So, like removing or reducing pain, making something easy and practical to use is going to improve that. And then, obviously, if there's any infection present, that should be treated. But it's important to note that the bulk of HS lesions are not infections. And if there is, for the most part, if they're tested or they're swabbed, it's non-pathogenic bacteria in those lesions. And any infection present would be typically a secondary infection. So it's just important to note, and it's mind-boggling because so much antibiotics are used in the management of HS, but they're predominantly for their anti-inflammatory properties rather than their antimicrobial or antibacterial properties. Good hygiene as well, I suppose, like counseling the patient on good wound hygiene, how to keep clean, and if you have any preference for topical agents or washes, I don't see any harm in that either.
Thank you for sharing this. I was excited, like we said in the beginning, because it is a great product. But and sometimes I tear up when I say this, but early on in my career, that's one thing I didn't concentrate on, but I didn't realize the impact that it affects the patients once they leave the clinic. And
Yeah.
so to bring that perspective, it changes how we treat patients. So thank you for sharing definitely your story, because we don't see that a lot.
No, I'm more than happy to, and I completely agree. I think we talk about patients, but we're people and we have lives, and actually technically we're all patients. So we will be, if we're not already, we will be someday. So it's always good to have an understanding of the impact that you can have as well if you implement an effective treatment plan, and you can literally change someone's life. And that's actually my call to action for your audience, any clinicians in your audience, is to in order to be able to treat HS, you have to know about it. So I think we've done a good job here. And I suppose recognizing the signs, because in looking back on my own journey, I had so many surgeries. I was seeing so many different doctors and nurses, and this was all happening before I was diagnosed. And if there had been a greater awareness of the condition 20 years ago, I think my journey would have been very different. And maybe one of the nurses who was coming to my home to do post-surgical wound care might have gone, this is the third time you've had this type of surgery in this area in the last 18 months. I think there's something else going on here. Just to kind of let the penny might drop a bit. But in order for that to happen, people have to know about the condition. So it's very easy to diagnose once you're aware of it. It's like, I suppose, the most straightforward way to recognize it is if the patient has recurring boils, more than 2 outbreaks or more than 1 outbreak in any of the typical areas: armpits, groin, buttocks, breast, in a 6-month time frame. It's most likely HS, and there's a good bit of research done on that. So I suppose that's my call to action, is just there's opportunities in healthcare to ask questions. If you see scarring, if you are seeing the same patient with very, HS-like symptoms, just to ask the question and say, have you ever talked to a dermatologist about this?
Yeah. Great. Well, we also don't want to leave our audience without solutions. And we know that as the founder of Hydraware, that you have created some really innovative solutions. So first and foremost, we're going to show you, Frank and I both are modeling.
Woo woo!
Beautiful. And I'll also do the...
Oh, fantastic!
And
So I also just want to show how great you have these absorbable pads that one can easily slip in. And then each of the absorbable pads comes with these tabs that then you go from the outside to secure them, so there's nothing against the skin and nothing that's bulky. But you can see great flexibility in there for sure.
Yeah.
And good hygiene, because you can also do it for your bottom.
Well, I think, do you have just a few slides to show us about what your product is, and so that we can offer it to our patients as a solution
Absolutely.
as well?
Yeah, so I started to develop Hydraware to help myself, really. But then after speaking to so many patients and seeing how big the problem was, I pursued it full time. And you can see here a little bit of an evolution of the product. And the picture of me on the right-hand side there is actually the first delivery of our very first actual product, after lots of different iterations and prototypes and lots of trial and error to get this right. But what is Hydraware is our product. So Hydraware is a 3-part system for the management of difficult to dress areas of the body. We have 4 different base layer garments: a crop top, a unisex t-shirt, and boxer briefs for men and for women. And they all have these perforations in the target treatment areas that you can see. So the pubic area, the inner thigh, the groin, and the buttocks for the boxer briefs, and the axilla and the side of the breast then for the t-shirts. And we use the garments with our advanced multi-layer dressing. So we have super absorbent dressings and we have foam dressings as well. And they're actually new to the product range. But the unique thing about the dressings is they come co-packed with the fastening tab, as you just described. So to use the product, the patient simply puts on the garment, inserts the dressing over the wound, and then secures it in place with the fastening tabs. And you took the little tabs in there at the end, just so that they're not catching on your clothes as you're moving around. And that's it. It's really quick, it's really simple, and it really works. So that's Hydrowear in a nutshell, and I'm really happy to share more information with anyone who would like to know more. But it's great to give you a quick overview of the product. And thanks for the opportunity again.
We want to thank you for being here today with us, sharing your personal experience and how you took care and developed a product for your problem. So thank you.
Yeah.
Thank you very much.
And then just one last thing that I wanted to ask before we say our goodbyes is, if a provider or even a patient, because we do have a lot of patients that watch our episodes, is, how can they, one, find out more about your product, or two, where can they order it, and like who carries it? Are there distributors that carry it?
Yes, so you can purchase the product directly from the website. And that's www.hydrowear.com, Hydra with an I, not a Y. And it's also available on a lot of insurances, which is great. So it can be ordered by your physician. There is an order form that has to be completed and sent into one of our partners, Prism or Rotec, and they're both US-based DME providers. They typically will bill the insurer and ship the product directly to your door or to the patient's door. The allowable is one garment every 6 months and 30 dressings per wound per month. So if you have multiple wounds, you can get one dressing for every wound. And the super absorbent dressings are, I suppose, really good for longer use. But you can change them out as required. And that's the beauty of Hydrowear, is you can just whip them in and whip them out as required. So I'm happy to provide any additional information. People can contact us directly at info@hydrowear.com, or, there's lots of information on the website as well.
I see you have 2 different size dressings as well. So it's nice that, if you don't need this size, you can still have this size available as well. So that's really exciting news. I know I wish I would have known about this, 15 years ago, but I guess it probably wasn't around then. So
no, we're relatively new, but it's amazing to see how quickly it's starting to grow in the US. And the feedback has just been phenomenal from patients. We've had parents contacting us about their teenagers starting high school and how much more excited they are about it now. We've had men contacting us to say they took their wife out on a date for the first time in months because they had their Hydrowear on and they just felt so much more confident. We've had, patients just contacting us to say how much it's changed their life and transformed their quality of life. And it's fantastic. And we've also done clinical studies that showed that Hydrowear reduces dressing-related pain. It's the patients in the study found it more comfortable and quick and easy to use. It improved body image and body confidence, and it improved quality of life using the Dermatology Life Quality Index score, which is typically used by dermatologists to measure the impact of a disease on a patient's life. So we know it works. We know it's available. So, it's a really great, I suppose, opportunity to help patients with a very simple solution that can have a huge impact quite quickly.
It's great. Well, thank you. Well, I don't,
Is it my laptop?
I
Is
think
it
it is.
my? Oh, I'm so sorry.
No,
Has it happened throughout the?
They say I like the horns coming out of your.
okay. Well, thank you so much for sharing your story, sharing your product, helping educate the World Wide Web, and our audience of the Frank and Lizzie show. We feel honored, and just as a testimonial, I've been wearing this. It's very comfortable. It's smooth. Seams are on the outside, very soft. I'm very much a texture person. And it reminds me, my autistic niece has very sensory issues with the clothing about where zippers are and things like that. Would fit the bill for her 100%. So, um, thank you so much again, Suzanne. Frank,
Thank you.
you look very handsome in your Hydraware attire. I think the ladies are gonna love it.
Yes, I
Yeah.
like it because it's showing a little bit of muscle.
We're looking for models, Frank. So I'll contact you after the show.
Hey, I'll be happy to.
Perfect.
All right. Thank you so much again. We'll have your contact information in the description as well, Suzanne. Appreciate you joining us today.
Thanks, everyone.